Hello, we're back with Dr. Ken Whidden of Emerald Coast Chiropractic. Welcome, Dr. Whidden.
Thank you, B. I'm happy to be here.
Well, I'm happy that you're here. I hear that you have a new location.
I do?
For your office.
Yeah.
Where is it?
Well, we've been at the our main office for about 11 years across from the Destin Harbor. Since about March timeframe, we started up a second office at Sacred Heart Hospital.
It's been since March?
Yep.
Wow, and I haven't been out there yet.
Yeah. We're up there on the 3rd floor in the medical office building, which is turned out to be a really good location for us.
What are your hours and days of operation at the Sandestin location?
Well, at this point in time, I'm the only doctor that we have, so I'm having to split some time between the two offices. I'm at the Sacred Heart office from Tuesday, Wednesday, and Thursday until noon.
Okay.
And then I transport myself over to the other office.
Do you teleport yourself over?
Yeah. I need to in the summertime because the traffic's pretty bad in Destin.
That's right. So Tuesday, Wednesday, Thursday till noon at Sandestin, and then all other times at the other office.
Yeah.
Okay. All right. What type of patient or what type of person would come see you, just in general?
Typically, we're going to get the folks that are looking for something a little bit more natural, they're trying to enhance their performance and their way of life.
Quality of life, maybe?
Yeah, we've got, the baby boomers are starting to age a little bit, and a lot of those folks are not wanting to take the prescription drugs, or they're trying to shy away from some of the surgical interventions unless it's absolutely necessary. So they're taking a look at what we can do for them, and we can kind of help either alleviate the problem indefinitely, or at least put it off to where they can enjoy a quality of life as they age.
So it's, I would imagine that chiropractic care is something that is continuing, but you can help them if again, you can't be specific, but if somebody is having back issues, let's say, and wants to put off or maybe totally avoid surgery, if they're the right candidate, you can come in and help them manage their pain, maybe get their backs a little stronger and avoid that.
Absolutely. We try to align the spine and then encourage them to adopt some more healthy lifestyle, make some lifestyle modifications where they start eating better, exercising, so that they can strengthen that body, so that they can stop a downward trend in poor health.
What kind of diagnostics do you do? Like, do you x-rays? And
right there at the office, we do x-rays. We don't necessarily x-ray everybody that walks in the door.
Sure.
We take a history on them and find out whether that's necessary. And we also refer out for MRIs if that's needed.
Okay. Do you accept insurance?
We do. We accept just about every insurance out there, and this is an exciting time of the year because people have met their deductibles a lot of times. So a lot of times there's little or no out-of-pocket expenses for them for both the chiropractic care and massage therapy, and they can be seen, help themselves get through a stressful period in the holiday period coming up, and not have to fork out a little bit extra money.
Now, you mentioned massage therapy. Is that something that's also done at your place?
Absolutely. We have 2 great massage therapists, and what we do for people when they come in, we'll check and see if their insurance covers massage therapy. In a lot of cases, it does.
Wow, that's new, and well, maybe not new.
We can actually send them to our website. They can fill out a little website contact form, and we'll check their benefits and find out if massage therapy is covered.
Great. So would somebody, say a typical patient comes in and they have some neck or back pain, they would see you first, and then you might work your magic on them, and then would you refer them to the massage therapist, or is that like a self-referral thing that they would do?
No, it could be either or, but a lot of times what we found is the massage therapy in conjunction with the chiropractic care, people get better, quicker results, and it just works out better as a complete system. And you mentioned neck and back pain, but we also do a lot of other issues. I treat a lot of sports injuries, and those tend to be foot, ankle, knee, hip, shoulder issues. All those things we can do a pretty good job on. We actually work on a lot of the runners, triathletes, and folks that wanting to get better, have better performance, so we can help them do a lot better. And we've worked on some really exceptional athletes, and it's helped their personal times quite a bit.
What are 3 things you would say that people could do during this time, the holidays, that they could just make some slight changes that would help them not have to come see you? I don't know if you want to answer that question. Maybe you don't want to.
No. People need to start. They got to exercise. They got to get off the couch and get away from a sedentary lifestyle, because a lot of times we're sitting in front of computers or in an office or answering phones, and we got to get out and exercise more. We're a body that's meant to move, and we need to move it, kind of get off the couch. And we also, going in the holiday period, there's a lot of food, a lot of goodies out there. We got to kind of back off, do some pushbacks and push away from the table a little bit.
So that's some exercise too.
Absolutely.
The pushback.
Push back from the table and kind of give your tummy a rest there. Because all this is stressful to your body, not working out, not eating right, not taking care of yourself, and then you throw in a stressful period of time like the holidays. It can, toward January, people are starting to break down.
Why would you go see a chiropractor versus another type of doctor? Is it because it's more of a holistic or more of a well-rounded approach?
Yeah, what you're looking at, basically what we're doing is realigning the spine and the body. Say you're working out and your spine is misaligned, you're going to start compensating for some of those misalignments. You're going to cause yourself an injury somewhere down the road.
Because your spine affects everything, because
yes.
everything's connected to it.
So if you're hurting, you've got some pain, and you're going to adapt to that pain, and you're going to adopt to some different faulty movement patterns, and you start moving differently, you use different muscles, and all of a sudden you have this unexplained injury, and it's because you've been working out or moving with a faulty movement pattern. It's kind of like with a car. If you have a bent frame and you throw in a bigger engine in this car, something's going to break eventually, and that's the way. Or if you're driving down the road and you have your front end's misaligned, something's going to happen down the road. You're going to have some wear and tear on that car. Something's going to break eventually, or you're going to wear out your tires or have a blowout, what have you.
So the takeaway is it all starts with proper alignment.
Yeah, you get that alignment, get that spine aligned properly. You're more structurally sound. You're going to be stronger. You're going to be able to perform better. Everything's going to work out better, and you're going to feel better.
And we're going to have big muscles like him, right? Right?
Yeah, I don't know.
Thank you, Dr. Whidden, for joining us. Our time is up, and we will see you before and after the holidays. We will be back.